Move straight to the U.S., that is the United States of America. We'll be speaking to BMJ Mureithi, who is a journalist with the Voice of America. He'll be speaking to us on matters of the coronavirus disease in that country. But we had promised you that we'll be speaking to Esther Githui. She's not able to make it for us this morning, but all the same, BMJ Mureithi is her colleague. And good morning. Actually, it's a good night for you. How are you keeping?
Very well, Sam. Yeah, it's good night for me because it's just about midnight here in Washington, D.C.
Mm-hmm. And so as we get to understand the coronavirus disease, of course, you've seen our numbers back here at home. We're at 50. But now in the U.S., you're almost, actually, some of the statistics are showing that you're already above 164,000. Some are showing that you're above 163,000. Explain to us what the mood is like, especially in Washington, D.C., even as you reflect on the rest of the country.
Yes, as you know, the Washington, D.C. is the seat of government, and it's here where, everybody is looking at Washington, D.C. to see what exactly is happening in the United States. So the mood today in Washington, D.C. is people are not really happy about the situation here because earlier today the mayor announced that there's a stay-at-home order which has taken effect, and people are trying to even understand what that exactly means because every state and every city has got its own way of announcing such orders.
Right. So far, there had not been any order of such. What were the preventive measures that had been instituted by the administration there in Washington, D.C.?
Well, there are a number of issues that have come up since, you remember when it was announced that the U.S. was getting its first cases. Since then, there have been lots of, people questioning how the president is handling this issue, and especially, immediately after he formed the task force, what they call here the White House task force, which has been trying to implement the measures that are, meant to mitigate this situation. The management of the whole thing has been such that not many people are very happy with that, especially those that are from a different political, different political opinion to Donald Trump.
Right.
And so, just to answer your question, the way they are doing it here is making sure that they give the briefings every day like they do in other countries. And so far, as I was telling you, here in Washington, D.C. itself, the situation is dire because the president has said that we are going to have to push, as you are explaining there, the social distancing guidelines,
right,
until April the 30th.
And what is the difficulty? Because I know that you are saying the president had not sort of taken these matters seriously, but the rest of us would expect that being the U.S., obviously you'd be on top of things when it comes to protecting the public there. What has been the biggest challenge in containing this pandemic in the U.S.?
The biggest challenge, or at least according to analysts that we have been speaking to, is the fact that the U.S. came in a bit late in trying to mitigate this problem. When it was announced that what was happening in China then, early in December, the U.S. did not take action immediately, and that has been, been named as one of the reasons why what is happening now is happening, and that it should have taken action, and things would be different today if action was taken in good time.
Right. And I'm looking at the numbers that would show that New York State has over 67,000 cases. So you'd imagine out of 164,000, then almost a third of, actually over a third of those cases are in New York City, or New York State. What exactly is the challenge that is affecting there, even as we start to draw lessons for Kenya?
Now the challenge is New York City, for instance, I know, Sam, you've been here and you know how it works here. New York City is the gateway to the United States. You know, they call it the capital of the world. And it is here in New York City that you find all sorts of people coming in from different parts of the world, even though the borders have been closed to some extent, you know, getting into the U.S. New York City has been hit mainly because of the people that are able to get in from different parts of the world. And one of the other major challenges is the fact that even within the United States, many people, you know, travel to New York for business and stuff like that. And you will remember that before New York, there were other places, for instance, you know, Washington State and California. And later, then New York has now become the center of attention in this respect. And all this, the explanation is that nobody really has a very good answer to this, but you know, they think it's really because the activity that goes on in New York. You know, it's a city that has almost 8 million people, and therefore this was expected. I don't know if, Sam, you have time that so that we talk about what exactly has happened in the last 24 hours. You know, because there was this ship that was a Navy ship that was taken to New York. It actually just docked yesterday, and it's a hospital, you know, full of all equipment that you would find in a hospital. And the main reason they took that hospital there, the ship there, is so that they can create some space in other hospitals or health facilities to be able to take care of these people who are sick,
right,
you know, who are suffering from COVID-19.
Right. Very, very interesting that you should say that. Of course, the US would have the means, but here in Kenya, we're still contending with the number of 50, which, of course, for us appears to be scary because we do not know where the disease moves to next. According to the Ministry of Health, estimations is that by the first week of April, which will start tomorrow, we should hit 1,000 cases. By mid of that month, we should hit 5,000 cases, and by the end of April, we should be at 10,000. I don't know what lessons you have seen that would be very instrumental for your home country here in Kenya.
Well, there would be lessons learned here, but to tell you the truth, Sam, we also are trying to contend and even understand what is happening with this disease, even here. As you say, it's a developed country, but there are many issues that not even the experts, you know, seem to understand. For instance, the day before yesterday, we had about 1,000 cases, and within less than 24 hours, that number more than doubled.
Right.
And today we are talking about close to 3,000 cases. That is the count that we had by 6 p.m. this evening, and therefore it shows that there's of course there's hope, but there's going to be a bit rough ahead because if we go by this at this rate, then it shows that because there are many people that have not been tested yet, just as it is in many other countries. The more people get tested, the more then we get to have the numbers go up, and unfortunately also the number of deaths, Sam.
Right. Unfortunately, the death toll keeps rising. Now you're at over 3,000 cases in the U.S. But finally, I would want to ask you this question because the U.S. health system, we know and we imagine that it's way advanced compared to the rest of us that we have in the country. But we see some strain on it. We see the president saying, the president of the U.S. saying that they are going to have more ventilators manufactured in that industry. I mean, how strained is it as of now, even as we report these 163,000 cases?
I didn't get that, Sam. Are you asking how easy it is to...
No. I'm asking how strained is the health system of the U.S. at this moment in time?
Yeah, it is quite strained, Sam, because there's a worrying trend where so many people are going into hospitals. Some of them are not even unwell, but because they need to be tested, and so they are streaming into hospitals, and therefore making it very difficult for the health workers, the personnel there, to cope. And that is why, one of the reasons why, as I said, there was need to take this ship from Norfolk here in Virginia all the way to New York, so that they can create some room for people who really need to be in hospitals because of COVID-19. And it's not just here in New York; it's across the country, Sam.
Right.
Where we are hearing, cases of doctors, nurses, health, personnel not being able to cope. So strained, really it is. And we have also heard of situations where even doctors and nurses are saying that they don't have enough equipment, as you spoke about, those ventilators.
Yeah.
That the president, by the way, has said that there are some companies that have agreed to make these ventilators and give them to the people that need them.
Okay, all right. Thank you so much, BMJ Murithi, of course, for those insights on what you are able to observe in America. BMJ Murithi is a journalist, the Voice of America Swahili Services, was speaking to us about the status in the U.S. Of course,